Thank you, Dr. Ewan. It gives me great pleasure to introduce our next speaker, Samantha Miles. Samantha Miles leads Knowledge East Training and Consulting Division by developing business opportunities and overseeing the team to ensure all projects are successfully delivered. She also engages in brand building activities and establishing and maintaining key stakeholder relationships with international and community partners. Throughout her career, she has led leadership roles in the higher education sectors worldwide. She has been responsible for the oversight of more than 300 educational programs, including a large-scale national project for human capital development in the areas of research output and impact, teaching excellence in medical education, and university student enrichment. She possesses 12 years of professional experience ensuring the quality and continued development of programs via strategic planning and ongoing assessment. Her research and teaching interests include global dexterity, teaching excellence, leadership development, and community engagement. She holds a bachelor's degree in elementary education awarded by the University of Central Florida and a master's degree in higher education leadership from Florida Atlantic University. Today, her topic for presentation is on clinical teaching and assessment in medical education. Thank you for being with us, Samantha, today. The floor is all yours.
Thank you so much, Dr. Pucha. I'm very happy to be here, and thank you for that really wonderful and professional introduction. If you all would just allow me 1 minute, I'm going to begin sharing my screen, and I hope that it comes through clearly. Just give me 1 second here. It's the end of the day, so first of all, thank you all so much for sticking with us in the room, and I'm really happy to be joining you. I'm actually joining you from Florida this morning, so it's good morning for me and good afternoon for you all. So I'm really excited to be giving this presentation, and of course, I want to thank Gulf Medical University, all of our colleagues at the university for hosting such an excellent conference. And I have to tell you, I was really interested when Professor Hossam, we were having a coffee and he said, Samantha, we're doing this conference and it's going to be called Quality Measurement in Health Professions Education, Revisiting the Metrics. And I just thought, what an interesting topic, what an interesting title. And so I hope that in my 15-minute presentation, I can share some of the key insights that we have shared and given within this topic. So what I plan to do with the next 15 minutes is to actually share with you key insights from a professional development program that our company, KnE, has delivered in partnership with the Egyptian Knowledge Bank for colleagues in Egypt. And this particular professional development program is on clinical teaching and assessment in medical education. So in the beginning of my presentation, I'm going to quickly give you a little bit of background information about the project and some of the elements of our delivery. Then I'm going to spend a little bit more time talking about the challenges that we face during this professional development program and what we found to be the most useful solutions to those problems. And then, in keeping with the theme of this conference, I want to talk a little bit about how we measured success in the program. And then if there's time, we can continue on with a few question and answers. So with that, let's dive right in. So of course, today's topic is quite large. And this is about all that we have time to cover. So of course, if you have any questions that we don't get an opportunity to answer, just shoot me an email and I will be very happy to connect. So let's begin with the first question, which is, what did we do in this program? So to give you an overview, as I had mentioned before, the key partners for this program are our company, KnE, and the Egyptian Knowledge Bank, which is actually a presidentially sponsored program in Egypt. I'm sure many of you who are in the region are familiar with the Egyptian Knowledge Bank. But the reason I highlight this is because we have found that these projects that we do in collaboration with the government body really have a wonderful opportunity to impact a large amount of people. And as you'll see when we talk about the participants, we had numerous universities participating in a single program, and that in and of itself leads to some unique opportunities with having colleagues from multiple universities interact and engage with each other and help to disseminate the knowledge. And very briefly, we have been working in Egypt for, this is our 6th year, last year was our 5th year, and we we've been working particularly around teaching excellence in medical education and doing several different what I would call micro professional development programs across many different subtopics. And so this particular topic was focused on how can we improve learner engagement, how can we improve assessment, particularly focused within the clinical environment in Egypt. And this program was delivered entirely online. And we had a wonderful global expert, Professor Mary Ellen Gussick, who was our course leader. And so she handled all of the teaching. She was our strategic advisor and designed the content. And she joined us from the University of Virginia School of Medicine. And so having an online program is, again, another way to connect wonderful colleagues. You know, Professor Tao had mentioned what they do at ScholarRx is really about connecting different colleagues. And so we enjoyed that opportunity as well. Our participants of this program, so we had a total of 50 who were enrolled in this cohort, and of those 50, 16 different Egyptian universities were represented, and by the end of the program, 31 had completed all of the requirements in order to be awarded a certificate. The duration of the program lasted for 3 months between July and September of 2021. And I won't go over and read all of the details, but as you can see here on this slide, I have outlined what we essentially covered in this program. So we consisted of 5 workshops, and at the very beginning, we wanted to do a program application and skills inventory. So as we move through the challenges, I'll talk to you a little bit more about selecting a cohort for these programs, but one of the key areas of success that we always see is having a rigorous participant selection. And so we always do an application and skills inventory, not only to try to select a cohort that is going to be engaged and possess a growth mindset and share what they've learned with others, but also we like to use our registration assessments as a baseline for knowledge so that we can then compare how they answered those questions, how they reflect on their teaching methodologies both before and after they have gone through this program. And in terms of the courses, of course, we always start with an orientation and a foundation principles of clinical teaching. Then we spent a good amount of time talking about OSCEs and OSPEs. Our 4th workshop was workplace-based assessment and the use of portfolios in clinical assessment, which was a topic that was highly requested by the audience, particularly in Egypt. The use of portfolios is something that many of our participants were very interested to learn more about. And then finally, we concluded with workshop 5, which was promoting learners' clinical development through coaching, feedback, and narrative evaluation. And so if we move on, the methodology that we always keep in mind when we're designing our programs are the principles of adult learning, andragogy, and understanding that there are the 5 assumptions of adult learners, and we want to ensure that we are catering to our audience. We are highly focused on experiential education because we all know, particularly in medical education, you learn by doing and you learn what you do, and so we want to make it as engaging as possible. And then finally, another element that's very important for us for these national projects is diffusion of innovation. And so essentially, when we are designing our programs, we want to design them in such a way where if 50 people are selected at the cohort, we want to have 500 people hearing about it. We want to make sure that we are empowering our participants to be able to share the knowledge that they've learned with their colleagues at their universities, across the different organizations that we work with. And so not only do we want them to learn, but we want to give them the tools to share what they've learned with others. And so these are the core methods upon which this program was designed. Now, if we move on to challenges, how did we respond to challenges? Well, first things first, let's talk about what we consider to be the greatest challenges in this program. Now, I might be controversial for saying this, but the online environment in and of itself, we do see as sometimes a challenge. Of course, it comes with many opportunities and a lot of great things happen from online learning, accessibility, or connecting with our peers overseas. However, we also find that, there are many, many professors who still love a face-to-face engagement. And I think all of us here who teach, that making something engaging online takes 10 times more effort than it does to engage in person. You can look somebody in the eyes, you can connect with them in person, you can sit next to them, you can coach them, you can say, oh, what are you working on? Well, why don't you try this, that, and the other? And doing that in an online environment it's harder. It takes a lot more effort. And so the quality of the engagement is an issue, but also because we are working in the MENA region, and sometimes our participants are joining and they don't have strong broadband, there are connectivity problems. And so that actually has presented itself as a challenge quite frequently that we face with these online programs. And so we wanted to highlight connectivity as one of the key challenges. The next impactful challenge that we faced was what I call value and quality versus time constraints. So as we all know, with any professional development program, this is a slice of time on the side for all of our professors. The 50 who are in our cohort are practitioners, they are mothers and fathers, they are teachers at their university, they are writing exams, they are mentoring, they're doing rounds at the hospitals, they have their own private clinics, and so on and so on. And so we're always faced with this challenge of how can we, as a private organization who is designing a short-term 3-month professional development program, create something that is really high quality, that doesn't demand the full-time attention of our participants? And on top of that, quality is one measurement, but also value. How do we make sure that our participants see value in what we're doing so that they actually want to commit that little slice of time that they do have? And so there's always finding that balance between those time constraints and between creating a really great program. And then the final challenge that I want to talk, and we'll talk a bit more about this at the end of my presentation, but it is really around how are we measuring impact? And so when we talk about impact for a program such as the one that I'm talking about, it's impact for the individual. So is there going to be value for them? Is it going to help them in their work? But we also look at institution. We want to positively affect the university, the institution. And then in working with a partner like the Egyptian Knowledge Bank, they also want to know, well, how are you impacting us positively at a national level? And you can see the icon that I chose is the little drop of water that's rippling out. And I think this is really relevant when we think about what we're doing, particularly in medical education. Of course, we all know, you're focusing on a professional development program for a professor, but how many students will they teach across the course of their career? How will what they've learned in a professional development improve that teaching? How will it affect that student? How many patients will that student see after they graduate, and so on and so forth? So we really see that ripple effect, and we try to take that into consideration. But the truth is, with any professional development program, it is really difficult to measure the short-term impact of a program. You need time to see that impact, and the scope, the sheer amount of work it takes in order to have what we would consider scientifically sound measurements of that impact are often really challenging. And then finally, I want to mention again those short versus long-term impacts. So how does it affect you as soon as the workshop is done versus has it stuck with you several years later? Are you still able to use it? And so these are all impactful challenges that we would consider when we are thinking about this program and reflecting on what went well. And so with that, I would like to share with you a few of what we consider to be the most impactful solutions. And if you just bear with me for 1 second, I'm just checking my stopwatch to know where I'm at on time. All right, fantastic. So in terms of the most impactful solutions, we found that in order to make this program successful, it was absolutely vital to use multiple technology tools. And so when we say that, we hosted all of this program on Zoom. We find that it is the most friendly tool with different options between meetings and webinars. It was very prevalent that we did a lot of modeling throughout the workshop. And so we did modeling in several ways. There was the course leader, but we also had our project management team who were acting as students, they were acting as professors. And so in that online environment, modeling was one of the teaching tools that got the best feedback from our participants. As I had mentioned before, rigorous participant selection, it's really important for us that we are selecting people who want to be there, who want to share what they've learned. And really, for us, the passion and the growth mindset is a more relevant factor than is previous experience, because at the end of the day, we want to empower professors with all levels of experience. And so the growth mindset and the attitude towards self-improvement is absolutely the #1 metric that we're looking at when we are going through those participant selection forms. And to give you a frame of reference, whenever we would host a workshop with maybe 50 participants, we would have maybe 400 or 500 who would apply for it, depending on how juicy the topic is. And so there's many people who want this training. And so we really take that responsibility seriously in terms of selecting the participants. Now, I had mentioned before the connectivity issues, and so we did a lot of role playing in particularly the second, third, and fourth workshops of this program. And so the way that we handled role play with connectivity issues is we made sure to have backup assignments for every single role within the role play. So there was always 2 people assigned to an individual role within the role play, and we actually found that was quite useful, particularly as we were going through using breakout rooms. If somebody dropped off, if their internet couldn't connect, there was always a backup person who could take on that role so that the role play wasn't interrupted. Because we're short of time, we had to make sure we were efficient, and so having backup assignments was really useful. The other thing that our participants particularly noted that they enjoyed in this program is we gave them a lot of autonomy and self-selection for the way they would group in the breakout rooms. And so what we found in this program is that there were 50 people and there were over 10 different specialities represented. And so rather than just having a handful, like let's say 4 breakout rooms, we made as many breakout rooms as were necessary. So even if a breakout room only had 4 people in it, we still facilitated that so that they could group themselves together, they could self-select to be within the speciality that made the most sense for them, and they really appreciated that. The next thing that we did in order to combat the challenge of the time scarcity of our participants is we made sure that when we designed this program, it did not have an excessive amount of formative assessment. We really based their certificate award on their level of engagement and their level of participation during the hours that our workshops took place. And so by doing it this way, we didn't make it impossible in order to actively engage. And so we really closely monitored their engagement. We closely monitored their participation. Yes, 50 is a big group, but we also have a large project management team, and so we were able to really keep a close eye on how our participants were working with each other, what they were gaining, how they were speaking, what they were doing in the role plays. And so our metrics for whether we awarded them a certificate or not was 80% based on their participation in the program. And then finally, we always made sure to give out a resource package both before and after all of our workshops so that if anybody dropped out because of internet, they were able to access recordings of everything, they were able to access the slides, they were able to access pre and post readings. And so having a consolidated resource package location online was something that our participants found very useful. And then finally, for us, having a comprehensive project management team to support our efforts. We typically have a team of at least 3 professionals on our side to support programs like this. And so it includes all of the wonderful teaching that happens in the classroom, but also in order to have a successful online program, there is a ton of administrative work. I had my team do out an itemized list of what happens for every workshop, and they came up with 187 items in order to make sure that it runs smoothly and professionally. And so having that teaching assistant, having that project management team to support you is something that we have found very, very helpful for us. Now I can see that I've been talking a mile a minute, but I still have a few more slides to go, and I can see that I'm just about out of time. So I just want to move on to how we measure success. So in this particular case and across all of the programs that we design, we are looking for what we call the 3 Ps. So we want to know that participants have had profound, powerful, and practical takeaways. When I say profound, what we mean is that we want participants to gain new knowledge that is both meaningful and relevant to them. We want the participants to be inspired to share their learning with others across their networks. And practical, I think this is the most important P, because we want to make sure that our participants are equipped with tangible takeaways that can be immediately applied in their current work situation. So these are the 3 most important things that we want to take away. And so this is really what we are measuring when we are when we are asking for feedback from our participants. And so we had a big shift about 1.5 years ago in the way that we did our survey design. And we shift away from a Likert scale where we might say, okay, do you strongly agree or strongly disagree? Will you share aspects of what you've learned with your colleagues? And so we shifted away from this format. and we went into short answer. And specifically what we did was we gave them 3 short answer boxes. So we didn't even just give them 1, we gave them 3. And we started saying, what specific learning did you gain during these workshops that you will share with your colleague? And the paradigm shift, this is something so simple, it's so easy. Now, when it comes to gathering data, yes, this requires more work when you're doing a report. You have to go through and make pivot tables, you have to categorize your data. So from the project management side of things, this is a harder task to do. But from a results perspective, this gave us incredibly powerful reporting and much more valuable insights. We were really able to gain so much more insights into what our participants found useful, what were the most important parts, and our participants in and of itself, they were doing reflections upon what they found most useful around the 3 Ps, being profound, practical, and powerful. And so you could see these insights. It's just so important, not only for us reporting to our client, who is the Egyptian Knowledge Bank, and letting senior leadership know how this workshop went, what do their people need, and how can we continue to improve. But for us as an organization who is delivering it, it has just been night and day in terms of the way that we are measuring our success, in the way that it is affecting our continual improvement cycle. And so just with that tiny shift in the way that we started doing our surveys, we saw so much improvement in the way that we're reporting. That is my final slide. I just want to end with a quote here. The great aim of education is not knowledge, but action, by Herbert Spencer. I would like to end by thanking so much my colleagues at Gulf Medical University who have organized this excellent conference. And of course, I have to thank the Egyptian Knowledge Bank and all of its participants, because without them, we wouldn't have the program. And thank you again for your time. And I will end it there.
Thank you, Samantha, for presenting this impactful program for promoting individual and institutional transformation. As I see, Samantha, we have a question from Dr. Hegwood, who asks, would this program be repeated in Egypt once more?
I'm going to say most likely. So currently in Egypt, we are collaborating with our partners at the Egyptian Knowledge Bank. It was a very, very successful program. So we are trying to make this happen. So I hope so.
Thank you, Samantha, for this